program is the Tri-Cities wraparound model of care for mental health in immigrant families with children aged 0 to 6. The project itself is a collaboration between the Tri-Cities Local Immigration Partnership and S.U.C.C.E.S.S with its multicultural early childhood development team. The project started in August 2022 and ended in March 31st, 2024. The project served the residents of the Tri-Cities area, which included the communities of Coquitlam, Port Coquitlam, Port Moody, and the villages of Belcarra and Anmore. The goal was that for the local immigration partnership to take the lead in supporting service providers, particularly early year service providers, to build their skills, knowledge, and confidence around mental health literacy and promotion, with particular focus on ensuring that there are resources and tools available using a culturally appropriate lens. And then for S.U.C.C.E.S.S to be able to lead testing the intervention of a wraparound model of care for immigrant families, where they would be able to support immigrant families in accessing any health supports that they may require, obviously with a focus around mental health. The unique thing about this project is that there was no eligibility status for the immigrant families who are coming. So they can be newcomers, they can be permanent residents, temporary workers, they could also be naturalized citizens. In the project, we developed and conducted a baseline survey with service providers to better understand what their training needs are, to better understand how we can support them in delivering mental health literacy programs in the community. That baseline survey really informed what types of training and what types of different workshops we can offer, and it also informed the tools that can be developed. We brought in immigrant panel. They are immigrant mothers who may have mental health challenges, who may have tried to access different mental health supports. The original thought was that we'll bring them together along with the service providers and they'll be part of, this general steering committee. What we realized, there were concerns around, am I gonna be talking to a representative from the Ministry of Children and Family Services? Is there going to be somebody there from the health department who might flag some of the challenges that I have? There is the power dynamics that we had to be really, really conscious of. And so to create a safer space, we actually decided to create a separate advisory panel. Their role there was to provide guidance to all the project activities, from planning to evaluation. From them, we heard about the importance of that one-to-one approach. It allowed for the unique needs of those families to really be reached. And the panelists also mentioned to us the importance of that culturally appropriate support. Being able to speak in their first language allowed them to express themselves freely. And I think part of that as well is the importance of being able to build that trust-based relationship between the program staff and the clients, right? And that really allowed them to really create those connections, to be able to share, some of the challenges that they're facing, and for the staff to be able to help them to navigate, to access, different services and supports in the community. The project team recognized the importance of stigma when talking about mental health. And so one of the things that the project did was creating unique programs that didn't talk about mental health in terms of a clinical diagnosis. We really looked at unique ways to embed mental health literacy in programs. So that included the use of storytelling. That included singing songs, right? And talking about emotions. They were able to do, parent craft time. They even had dad and tot story time to allow for the primary caregiver to be able to have that time for themselves, to create that self-care moments, while the alternate caregiver can go to a story time with their children. They actually had art therapists facilitate different groups to create art, to talk about gratitude, to talk about the connections that they have with family members, or even their networks as well. Another key feature is around the tools that were developed. We developed, emotion magnets. We had them translated in different languages. We also developed a conversation starter card for service providers. So the conversation starter card was done in collaboration with Indigenous artists to really show that there are many creative and different ways to approach mental health to reduce that stigma. And so we used different expressive art modalities like use of food, music, touch, scent, as a way to build different emotional literacy skills. We wanted to use these tools for service providers to start conversations with their clients, with their families, to facilitate that dialogue, because sometimes it's hard to talk about mental health, but it's easier to talk about food and how that makes you feel, right? And so those are some of the unique approaches that the program did. We engaged various organizations to enable that stronger referral pathways. And so we invited them to be able to share their services, their programs with one another. And it was great to see the connections that were made to the point where now there's more referrals coming from early years programs to, government programs or other community resources that may not have been, well utilized in the past.
So there was two big buckets of clients. So the first one was for practitioners. So for the capacity building activities that we did with practitioners, we used more of a quantitative methodology to be able to get at the outcomes for that. So we did post-activity surveys to get a sense of the extent to which the clients had gained knowledge, had learned about new tools, and had learned how to implement it into their work. And then to get a bit of a deeper insight, we did photo voice with some of the practitioners. So photo voice is a really interesting way of getting at some of those deeper experiences. So you ask participants to take pictures in response to a question that you're posing, and then to write up a little blurb about their experience, and then there's a discussion after. So that's how we did for practitioners. We also did photo voice again with MECD staff to get at outcomes for clients through the staff who had been working with them. Then the second part of this for newcomer clients, we were really looking to get deep insights into their experiences. So for that, we used a qualitative methodology. One of the most interesting things that we did with clients was actually through journey mapping. So the journey mapping was done by the MECD staff. We trained them to do that. And it's to walk clients through their journeys into being a mother, accessing services, their first meeting with an MECD staff, and then after a few meetings, and then at the end. So it really represents their journey, and it's meant to see the benefits or the changes that they see throughout. So, and at each step of the process, you ask them things like, what was your need here? What were you thinking? What were you feeling? What were your emotions? What were some of the successes, some of the challenges? So it gets a really nice journey of a client. So what we found for practitioners is that it met their needs and expectations. Not only did they gain knowledge about mental health promotion, for example, but they also understood the complexity of mental health and speaking about mental health, and they gained deeper insight. So, for example, through photo voice, one of the practitioners presented a picture of water with rocks. So the water at the front is calm, and then the further you go, it's more agitated. And then so the reflection that was on that was that sometimes you don't know where a client is in their journey. So you think that they might be in the calmer waters at the front. But because of the training that they had, they were able to learn how to ask questions and how to have those conversations to get at those deeper issues for clients. We also asked them if they were likely to use this knowledge in their work. Most of them said that they were likely to use this because they work in this environment and because the training were practical and that it was something that they were able to use right away.
You know, the outcome from, hosting and organizing various trainings and the resources that were provided we really saw lots of different mental health programs being implemented in the community, and it continues to today, where they are bringing in, mental health guest speakers. They're bringing in different components from those trainings that they were able to then implement.
And then for newcomer clients, what we found is that the programs and services that were offered have a value. The newcomer clients, like the newcomer mothers and their families, became more aware of the importance of mental health. They were more aware of their own feelings and how to talk about those feelings with their families and with their children. But you want to go beyond that. Like, you want people to be aware, but you also want them to improve their mental health and being able to, so that's the second part. So they were able to improve their mental health. When we look at the journey maps of clients, when we see, so at first when they haven't accessed the services, they're lonely, they're unhappy, they don't know how to talk about their feelings. There's a lot of tension with their families, with their children. But as they go through their journey and they access services and they learn that they are happier, that they know how to talk to people, they just have the tools to be able to be better parents because they're able to have those conversations. For newcomer clients as well, they connected with other people that were in the programs with them. So they connected with community. So it's really important to have these programs with other folks that are going through the similar experiences. So there were some friendships that were formed, and just being able to speak to the MECD staff helped them to build that trust and that rapport to be able to share. And not only that, but also to be able to share more about what they need so that they can access the services later on. So being able to know what services there are and knowing where to access them.
So I found myself was struggling all the time to balance parenting with adjusting to this new community. So that's when I reached out to S.U.C.C.E.S.S, and the Korean service team responded to my email inquiry very promptly, and they warmly welcomed me to join. So they gave a lot of information about Coquitlam City, and they introduced me a lot of programs like Motherhood, Parenting Club, Nobody Perfect, FRC, one-on-one session, and make the connection, lots of things. And actually, I joined in every single program. It's really good for me. And these programs has been a really great help for me to have such a wonderful parenting skills and strategies as a mom. And also, it gave me a supportive network of fellow moms who understand my situation very well. And it's really great to meet them. And yeah, it just made me less feel alone, and also it made more connected to this new home in Canada.
佢可幫到我去解決一啲我生活上其實都遇到啲唔識嘅問題啦，即係教小朋友啊，點樣同佢哋相處啊，同埋自己語言上面嘅困難啊，喺度當中其實係學到好多，大家可以揾到有啲同聲同氣嘅人朋友喺度啦，咁唔識嘅話可以大家互相去學習啦，同埋提供一啲幫助啦，咁樣係可以學到啲新嘅嘢，同埋教養到小朋友咯，新方式、新方法咯。
So the advice that I would give organizations that are looking to do a similar program as this one is first to understand the needs of clients, whether it's the practitioners, whether it's the newcomer clients, just to get a good sense of what are the gaps in knowledge, what are the ways, what are the barriers to access, to just being able to do that first. I think it's important to have newcomer voices included in the design and implementation of the program, like was done with the newcomer voices panels for this one. Collaborating with stakeholders is another piece of advice that I would give, because this is a system-wide issue, mental health, immigration, being able to access services. Having those organizations in your community part of a steering committee, for example, like was done for this project, really helps to share the knowledge on this issue, to be able to access referrals or resources from other organizations. The other thing is to adopt a culturally competent approach to this. So whether it's by having staff who are from a same cultural background, to be able to have services offered in multiple languages, or to talk about mental health in a culturally appropriate way, those are really important. The one-on-one sessions, make sure to include them in the program, but not as standalones. They need to be integrated with other group activities so that newcomer clients can connect with others, but also can meet the diversity of their needs, just not in the one-on-one. Similar for the practitioners. So what we saw is that practitioners took part in more than one training. So many of them took part in more than one training. So we see the value then of having a series of training to be done. But this series of training would need to be informed by a needs assessment, and there's also the piece that is needed of being able to apply it into practice and being able to discuss tools that they've learned. And of course, being an evaluator myself, I think the advice that I would give organizations is, yes, this can work in your community, but you should do an evaluation to look at the implementation, but also the outcomes, just to make sure that what you're delivering is what you're intending to deliver.